Hi, good evening. I'm Dr. Shrikanth Associate Consultant of Medical Oncology at HCG Cancer Center at Hubli. We all know that April month is Head and Neck Cancer Awareness Month, so I would be giving a short talk on head and neck cancers. Head and neck cancer is the most common cancer among Indian males, and its incidence is rising day by day. In fact, the incidence of head and neck cancer is projected to rise by 50% by the year 2040. Head and neck cancer includes cancers of the oral cavity, oropharynx, hypopharynx, esopharynx, and larynx. Tobacco in any form, either the combustible or the non-combustible, chewable, the various forms of tobacco are the most common causative agent of head and neck cancers, contributing to about 80 to 90% of cancers. That, coupled with alcohol consumption, has a synergistic effect, and the incidence of head and neck cancer drastically rises when the patient is addicted to both. If oral cancer is detected early, then the chances of cure approaches 80 to 90%. But if it is detected late, then the 5-year overall survival drops to 50%. So it is very vital to detect the oral cavity cancer at an early stage. Compared to the West, where 60% of the head and neck cancers present at an early stage, in India, only 30% of the head and neck cancer patients present at an early stage. These patients are treated with a curative intent, either with surgery or radiotherapy or a combination of both, depending upon adverse risk factors. Only about 20 to 40% of patients will develop a local or regional tumor recurrence, the majority of which occurs within the first 2 years. After the first 2 years, it's very rare to have a regional tumor recurrence. Rather, the incidence of second primary malignancies such as lung cancers, esophageal cancers, and stomach cancers increase. And this increase is about 3 to 5% every year. Thus, with sufficient time follow-up, the risk of secondary malignancies such as the lung cancer and esophageal cancer increase with time, and the risk of regional tumor recurrence decreases. It is very important to understand that the cancer cure depends on the cancer stage when it is diagnosed, and after which the patient starts to receive the treatment. It is most important to detect these cancers at an early stage. The government should bring strict anti-tobacco rules. Schools and colleges should conduct anti-tobacco awareness campaigns so that the youth do not get addicted to tobacco in any form. Alcohol consumption should be prohibited, and the advertisements for the same should be under control. Also, the high-risk people such as tobacco chewers, betel nut chewers should be targeted, who are aged between 30 to 60 years. An opportunistic screening can be implemented, and this can help target patients who are at high risk of other non-communicable diseases as well. This would help detect cancers at an early stage as well as address other non-communicable diseases at the same time. A simple oral cavity examination by auxiliary healthcare workers can also help address this issue and detect these cancers at an early stage. Thank you.